The 63rd meeting of the National Council on Health has been declared open. The focus is on the need for the federal government to make deliberate efforts to reflect key pillars to strengthen the health sector. TVC News health correspondent Keey reports that the theme for this year's event is building a resilient and sustainable health system for improved health outcomes and universal health coverage.
Nigeria's healthcare system has been hit by the strain of dealing with the pandemic and the current battle to tame the internal outbreaks of Lassa fever, cholera and monkeypox. It is now time, as the year comes to an end, to re-strategize and make moves ahead of other epidemics and pandemics through recommendations of a paradigm shift towards promoting the health of citizens and preventing diseases. This important strategic meeting of the health sector by the highest policy-making body is seeking to set the agenda for Nigeria's health sector reform for universal health coverage. The agenda takes off from the World Health Organization, highlighting some of the key pillars of concentration. These include primary health care, local vaccine production, health insurance, and climate change at the top of the list.
The WHO, as a member state organization, will depend on the strategic guidance of the health sector plan, which will be enriched by the outcomes of this National Council of Health to translate these into Nigeria country cooperation strategy, even as we advance efforts toward 2024-25 program budget.
Trying to ensure that going forward our health system will be able to cope with any shock that comes its way. We hope that we can avoid the shocks, but when it does happen like the COVID-19 pandemic did, we'll have a system that can respond quickly, respond consistently, and respond effectively.
Experts here still believe that universal health coverage is still achievable through self-auditing evaluation, starting from states.
What we do is we strategize, we set up a special council monitoring committee to interface with states and find out what are their challenges, and then we try to mitigate to make sure that at least they also achieve reasonably.
We must monitor and evaluate with measurable indicators. So in January, where are we? In March, where are we? In December, where are we? If we are not making progress, that's what they call self-auditing. You go back and check. But a situation where you are not monitoring anything, the health sector can be going down the drain and nobody will even know.
Participants here all admit that accelerating efforts towards building a resilient and sustainable health system will encourage national development. Keey, TVC News, Abuja.